Welcome back. There's a new warning that comes with quarantining at home. You may not have heard this one. Make sure you wear shoes. Doctors are seeing an uptick in the number of patients complaining about foot problems and more, likely blamed due to people not wearing shoes during this pandemic. So we're going to bring in an expert now to talk to us about this. Dr. Zachary Vaupel, thank you for being with us this morning. You're with the Michigan Orthopedic Surgeons Group.
Correct. Good morning. Thank you.
So have you indeed seen a rise in the number of patients complaining about foot and ankle pain during this pandemic due to walking barefooted?
Yes, absolutely. We have seen a rise in these problems, which is ironic because we typically think of foot and ankle and other musculoskeletal problems as being activity related. And I think all of us have been a little less active during the pandemic. But there's definitely been an increase in patients in my office with common causes of foot and ankle pain. Things like plantar fasciitis, metatarsalgia, which is pain on the pads of the feet, tendonitis, exacerbations of arthritis. And it is because more of us are at home all day in school or for work, and we're walking around on a hard surface in bare feet.
Yeah, it's funny because Kevin and I were just talking in the break that a lot of parents are like, hey, when the kids come in, take those shoes off, take those socks off right now when you're coming in the house. But what do you recommend people do if walking barefooted for long periods of time can impact you negatively?
Well, I certainly agree with taking your shoes off from the outside. There are a lot of germs and allergens that can be carried in on outside shoes. So I recommend people have an inside pair of shoes, and that can be a pair of running shoes, walking shoes, or even a well-padded pair of slippers will do the trick too.
Does age play a factor here?
It does, mostly in the context of arthritis pain. Without the shock absorption of a well-padded shoe or slipper, the joints in the body see more force when we're walking. And if you don't have that padding, that can certainly exacerbate arthritis pain. Let's
talk a little bit about the natural padding on the bottom of your feet and why it's important to get that extra padding from shoes or slippers. Does that natural padding kind of thin over time?
It does. The padding on the bottom of the foot is on a microscopic level in a sense like bubble wrap. And like bubble wrap, over time it can pop, leading to less shock absorption. So we call that fat pad atrophy, and that can cause a lot of pain in the foot. So we do recommend padded shoes because of this.
And once that's popped, so to speak, you never get it back, do you?
Exactly, yeah, there's no replacing that.
So what kind of treatment do you suggest for people who've had some of these issues?
Well, the first thing I tell my patients is, like I said, well-padded footwear in the house with a good arch support. That takes a lot of pressure off the bottom of the foot and decreases the amount of force the joints see. The second thing is stretching. So the muscles in the back of the leg, the gastrocnemius muscle and the soleus muscle that we commonly refer to as the calf muscle, if we stretch those structures out in the Achilles tendon, biomechanically, that actually leads to less pressure on the foot and ankle. And also weight loss is a big thing. We know that 3 to 6 times body weight goes through the foot and ankle just with a normal step. So I always encourage people to lose weight because that will decrease the force in the foot.
So if someone has foot pain today, right now, they have New Year's resolutions, they're trying to lose that weight, do they still exercise through the pain?
Well, it depends on what it is. Certainly if you have persistent pain, I would recommend you see a fellowship-trained, board-certified orthopedic surgeon. And I do recommend lower impact things if you're having foot pain with exercise. So things like swimming, biking, elliptical ride, those are good exercises if you're having foot pain with running and walking.
Great advice. Thank you so much, Dr. Zachary Vaupel with us from the Michigan Orthopedic Surgeons. We really appreciate your expertise today.
Thank you.
Put those shoes on, Kevin.
Yeah.